It is the third most lethal form of cancer. Just last week, former Fox 2 broadcaster Don Johnson lost his life to pancreatic cancer. Jeopardy star Alex Trebek also died from the disease. November is Pancreatic Cancer Awareness Month. Dr. Lannis Hall is a radiation oncologist with Washington University. She's with us this morning with more on the warning signs. Good morning to you.
Good morning. How are you?
I am very good. First off, the third most lethal form of cancer.
Yes, and it is not one of our more common cancers. It has been very difficult to treat pancreatic cancer because most men and women who are diagnosed have advanced or metastatic disease. And so there are no real early signs or symptoms, and we don't yet have a great screening test for this disease. So those are two of the main issues with pancreatic cancer, is that it spreads outside of the confines of the gland before it's diagnosed, and then curative surgery cannot be offered.
Is it preventable, or are there risk factors?
So there are risk factors, and some of them we can't do anything about, like our age. It really is a disease of older people. Most people are over the age of 60 who are diagnosed with pancreatic cancer, but new onset diabetes after the age of 50 is a risk factor. Carrying excess weight is a risk factor. Having a family history of a cancer syndrome, and one that people don't put together is our breast and ovarian cancer syndrome, the BRCA gene. Most people think, oh, that's a gene that's only in women. No, we all have this gene. It helps to repair our DNA and protect our cells, and if that gene isn't working properly, there are several tissues that have an increased risk of developing or transforming into cancer. Breast, prostate, ovarian, and pancreas. So knowing your family history, and this is November, right? It's Thanksgiving.
Yes.
Talking about this with the family, and then sharing that information with your primary care physician to make sure that you're not at higher risk and need particular referral to a genetic counselor. That's important information to share with your primary care doctor.
Absolutely. Of course, research is key, and Washington University at Siteman Cancer Center just received a grant. Tell us about that.
It's an $11 million specialized program of research excellence, and we have some incredible scientists, researchers, and clinicians who are all going to be working together around trying to find more effective therapies for vaccines and also for our we call it immune therapy, harnessing our own immune system to eradicate and destroy pancreatic cancer cells, and finally looking at combinations of chemotherapy and targeted therapy together. So incredibly exciting, one of very few in the country.
Yeah, it seems like there's so much more research to be done on this.
Yes, there is, and that brings me to a final point. When you have a disease where we're really trying to do better in screening, diagnosis, and treatment, we have to participate on clinical trials. Clinical trials are how we advance from what we've done 20 years ago, 10 years ago, to the advances we have today. And we know that men and women who participate on clinical trials live longer. And so accessing these new advanced and exciting potential therapies are important in this disease. And African American men and women who have a higher incidence and mortality of pancreatic cancer really need to seek out clinical trials so that they can have exposure to guideline-directed care and new therapies.
Oh, Dr. Lannis Hall, thank you so much for coming in this morning and
You're
shedding light
welcome.
on this. We appreciate it.
It's my pleasure.
7:19 is our time. We're going to send things over to Tim.